Welcome to PsyEduInsights, your reliable source for understanding complex psychological concepts. Our mission is to break down the barriers of psychology, making it accessible and understandable to all. Whether you're a psychology student or simply someone with a curious mind, our goal is to provide you with accurate, digestible information that unravels the complexities of the human mind. We're committed to delving into a wide range of psychological topics, always ensuring that our insights are based on established research and current psychological theories. We aim to be your go-to resource, a beacon in the often foggy landscape of psychology. At PsyEduInsights, we believe that knowledge is power and that a deeper understanding of psychology can help us navigate life's ups and downs more effectively. So, get ready to explore the labyrinth of the human psyche with us. Today, we delve into the intriguing topic of reactive attachment disorder. Reactive Attachment Disorder, or RAD, is a complex psychological condition that requires our attention. To break it down, reactive attachment disorder is a rare but serious condition in which infants and young children fail to establish the kind of healthy attachments to parents or caregivers that are considered essential to development. Now, when we talk about healthy attachments, we are referring to the emotional bond that develops between a child and their primary caregiver. This bond is key in shaping a child's ability to form and understand relationships throughout their life. However, a child with RAD lacks this emotional bond. They struggle to form meaningful connections with others, and this often manifests in their inability to seek or respond to comfort in times of distress. This isn't a simple case of a child being shy or introverted. It's a profound and enduring issue that can severely impact a child's social and emotional growth. It's important to note that RAD is usually diagnosed before a child reaches the age of 5. Why so early, you may ask? Well, this is because the first few years of life are critical in forming attachments. By this age, if a child is showing signs of RAD, it's likely that they've been experiencing difficulties for some time. Now let's get one thing straight. Having RAD doesn't mean a child is bad or broken. It's not a reflection of their character or potential. It's a sign that they've experienced significant social and emotional disruptions, and they need support and understanding to navigate through their unique challenges. It's also important to remember that while RAD is serious, it's not a life sentence. With early diagnosis and appropriate treatment, children with RAD can go on to form healthy relationships and lead fulfilling lives. Now that we know what RAD is, let's examine the diagnostic criteria. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition text revision, or DSM-5-TR, helps professionals diagnose RAD. This manual is widely recognized and used by mental health professionals worldwide. It provides a comprehensive list of criteria that must be met for a diagnosis of reactive attachment disorder, commonly known as RAD. So, what are these criteria? Well, first and foremost, the DSM-5-TR stipulates that there must be a pattern of inhibited, emotionally withdrawn behavior towards adult caregivers. The child rarely seeks or responds to comfort when distressed. They might show no interest in playing interactive games, or they may not even respond when someone tries to engage them. This is not a case of a child simply being shy or introverted. It's a pervasive pattern of emotional detachment. But that's not all. The DSM-5-TR also requires evidence of social and emotional disturbances. The child may have minimal social and emotional responsiveness to others, limited positive affect, or episodes of unexplained irritability, sadness, or fearfulness that are evident even during non-threatening interactions with adult caregivers. Now, within RAD, the DSM-5-TR identifies two types: the inhibited type and the disinhibited type. The inhibited type, which we've just discussed, is characterized by a failure to initiate or respond in a developmentally appropriate fashion to most social interactions. The disinhibited type, on the other hand, is marked by indiscriminate sociability or a lack of selectivity in the choice of attachment figures. A child with disinhibited RAD might be overly familiar with strangers or lack the usual wariness of strangers that most children have. It's important to note that these symptoms must be evident before the age of 5, and the child must have a developmental age of at least 9 months. Also, these disturbances must not be better explained by an autism spectrum disorder or better accounted for by a general medical condition. With the diagnostic criteria laid out, let's look at what causes this disorder. Although the exact cause of reactive attachment disorder, or RAD, is unknown, certain factors increase the risk. Let's delve into these risk factors and explore the symptoms that may indicate a child is grappling with this complex disorder. Risk factors for RAD are usually rooted in early childhood experiences that disrupt the formation of a healthy bond between the child and their primary caregiver. Neglect is a significant contributor as it deprives a child of the essential emotional nourishment needed for healthy development. This could be physical neglect, such as not providing adequate food or shelter, or emotional neglect, like ignoring a child's need for comfort and affection. Abuse, whether physical, emotional, or sexual, is another strong risk factor. Such experiences can distort a child's understanding of safe and loving relationships, hindering their ability to form secure attachments. Frequent changes in caregivers can also trigger RAD. Children who have been in and out of foster homes or those who have been adopted multiple times often struggle with forming stable relationships. The lack of a consistent, nurturing figure in their lives can lead to feelings of insecurity and fear, key elements in the development of RAD. Lastly, a lack of affection and positive reinforcement can also contribute to RAD. Children need to feel loved, secure, and valued. Without these affirmations, they may struggle to develop a healthy sense of self and a capacity for empathetic relationships. Now let's move on to the symptoms. Children with RAD may exhibit a range of behaviors that are unusual for their age or developmental stage. These may include withdrawal from others, unresponsiveness to attempts at interaction, and inappropriate interactions that are either overly familiar or excessively inhibited. In some cases, these children may seem indifferent to their caregivers, showing little or no preference for them over strangers. They may also fail to seek comfort when distressed and reject efforts by others to comfort them. These symptoms can be distressing for both the child and their caregivers, but recognizing them is a critical first step towards seeking help and treatment. Understanding the causes and symptoms of RAD helps us recognize it. Now let's discuss treatment. RAD can be challenging, but with appropriate treatment, children can develop healthier relationships. Now let's delve into how this is achieved. First and foremost, the cornerstone of treatment for reactive attachment disorder is providing the child with a stable, caring environment. This is crucial as it offers a sense of safety, predictability, and calm, which are essential for the child to build trust and form healthy relationships. Imagine being in a place where you feel secure, where you know what to expect and where you are cared for. This is what these children need to start healing. Now, within this nurturing environment, therapeutic strategies can be put in place. One such approach is play therapy. This isn't your run-of-the-mill playtime. It's a form of therapy where the child is encouraged to express their feelings and thoughts through play, under the guidance of a trained therapist. It's a safe space for them to explore and understand their emotions and in turn help them connect with others. Then there's family therapy. This is where the child and their caregivers, or family, work together with a therapist to foster understanding and improve communication. The goal here is to strengthen the bond between the child and their caregivers, which is invaluable in creating that secure and caring environment we spoke about earlier. Another important aspect of treatment is education. This involves teaching the child and their caregivers about RAD, its causes, its effects, and how to manage it. Knowledge, after all, is power. The more they understand about RAD, the better equipped they are to handle the challenges it presents. Now you might be wondering about medication. Well, medication is not typically used to treat RAD. However, it may be used to treat associated conditions such as anxiety or ADHD if they are present. Just as with any disorder, early intervention and treatment are key to managing RAD. Remember, with the right support and care, children with RAD can learn to form healthy, secure relationships and lead fulfilling lives. Today, we have explored reactive attachment disorder, a condition that affects a child's ability to form relationships. We delved into the intricacies of its definition and the diagnostic criteria as per the DSM-5-TR. We shed light on the causes and symptoms, highlighting how early life experiences play a significant role in its onset. We also discussed the various treatment options available, emphasizing the importance of early intervention and therapeutic strategies such as play therapy and family therapy. It's crucial to remember that each child is unique and treatment must be tailored to suit their specific needs and circumstances. In essence, reactive attachment disorder is a complex condition that requires understanding, patience, and professional help. But with the right support, children with RAD can learn to form meaningful relationships and lead fulfilling lives. Thank you for joining PsyEduInsights today. Remember, understanding is the first step towards empathy. Please subscribe for more insights into the world of psychology.